Hey everyone, my name is Manu, Kalia. I'm a physical therapist and Ayurvedic herbalist. Ayurveda is East Indian holistic medical system. I practice integrative medicine. I combine both Ayurveda as well as physical therapy and exercise science for rehabilitation and recovery after injuries. So today's discussion, we're going to talk about a little bit about knee problems and knee injuries and what you should and should not do after the injuries to help the healing process. So very important first to figure out what kind of problem you have, whether you have an injury, whether you're having pain, and whether you're suffering from some other issues with the knee. Whether it's the ligaments that are injured within the joint, the intra-articular ligaments, your ACL or PCL ligament, or the ligaments on either side of the joint, your MCL or LCL, or for that matter, the meniscus, which is basically the cushion between the joint, or the joint capsule is injured, or the cartilage that's inside the joint is worn out. Right? There's an arthritic conditions. So it's important to figure those things out, or for that matter, the knee joint itself is affected, right? And with that, the kneecap or the patellofemoral joint is not gliding properly, or it has wear and tear to the cartilage underneath it, resulting in pain or difficulty walking or other issues going on. So it's important to figure those things out first before you design or before you decide to do certain exercises, right? So it's recommended that you talk to your physician or your physical therapist if you have an injury or are suffering from problems, to rule the certain things out, and then you progress forward with a particular exercise program. And it's not just the knee joint that could be problematic. So problem could be coming from somewhere else too. So if I have foot issues going on, or I have flat feet for that matter, or I have excessive pronation of the foot. So those things biomechanically, they can alter or affect things further up in the chain. Or for that matter, the hip. If I have hip issues going on, or that my pelvis is off, or I have scoliotic changes, scoliosis of the spine, can affect things further down in the chain too. So someone like a physical therapist can look at those things and figure out where you're having those biomechanical problems and how to correct those. You keep treating the knee, but if you don't address the source or the cause of the problem never gets better. Okay? So, but once I have a problem, let's say I have pain, or for that I have swelling, I have inflammation around the joint, the knee gives out, there's locking of the joint, there's clicking, popping in the joint, or it just doesn't feel right, doesn't feel stable. Okay, whether it was from an injury or whether progressively over time there's wear and tear, and I'm having these issues. So once I have those problems, what do I do? In addition to seeing your physician or your physical therapist, some basic things you can think about are, you want to use some form of assistive device, or a cane, or a walker, or a crutch. Take the weight off the joint. It's a load-bearing joint. It doesn't like weight-bearing. It doesn't like to be loaded. And load-bearing could be walking, could be standing, could be going up and down stairs, could be squatting, could be kneeling, could be any of those things. So avoid those activities or reduce them. Support the joint. Wear some form of brace around the joint. Okay? Help reduce the swelling or the inflammation or irritation that's taking place around the joint. But number one, by unloading. Number two, by supporting the joint, giving it some assistance with a cane, and for that matter with a brace. Using ice or heat depending on what is indicated for the problem. Okay? Elevating the joint, keeping it off the ground, helping reduce the swelling in the joint. And then you work towards progressing into a strengthening or flexibility range of motion program. If you've lost flexibility, if I've lost my range of motion, I can't straighten the joint, or I can't bend the joint for that matter. Okay? So then you begin the program to get the range back, or I work towards getting the strength back of the muscles around the joint. So muscles above and below the joint need to be strengthened. Remember, anytime I have swelling, inflammation, pain around a joint, there's inhibition. So the local muscles around the joint get shut down. They don't function as well. So now I have pain, swelling, inflammation, irritation around the joint. And that's causing the local muscles, that's, for example, my quadricep muscle above my thigh muscles to shut down. But I continue to walk on that joint, which irritates the joint further, the walking, and the local muscles aren't supporting the joint as well because they're not firing as well. They're shut down. They might have atrophy, or they just can't contract as well. So they don't give the stability or the support to the joint. So I further aggravate the joint because of the loading, right? So very important, the unloading part, right? And then with the strengthening. So I have to strengthen my quadricep muscles. I have to strengthen my hamstring muscle, which is back of the thigh. I got to strengthen my calf muscles. I have to go even further up and strengthen my hip muscles, my glutes. Very important. Okay? So strengthening all those muscles, restoring the mobility or range of motion of the joint, your tibiofemoral joint, the main joint, this one, as well as your patellofemoral, between the patella or the kneecap and this groove right here, femur. Okay? Restoring that mobility or proper mobility so it glides in the right direction within its groove. So restoring that mobility, restoring the strength, reducing the swelling, irritation, inflammation, so that joint doesn't get more problems, arthritic conditions, or gets more wear and tear within it. Okay? So all those things need to be looked at. So I hope this was helpful for you guys, just to give you some basic guidelines. And for that matter, think about it as going up and down the stairs. Right? Going up with the stronger leg, coming down with the weaker leg. Okay? So going up with the leg that's not injured, coming down with the leg that is injured. Okay? We'll put less load on that joint. So you have to really think and be aware of day-to-day activities. You know, standing in the kitchen too long, getting up and down off the floor, lifting things. All those things need to be looked at because they could be contributing to ongoing irritation of that joint. Okay? So I hope you guys found this helpful, and the next lecture I'm going to show you a few exercises for range of motion as well as getting that strength back, some basic exercise. Thanks for watching, guys. I appreciate it, and hope you enjoyed the video. And please check out the next video that I'm going to put on, which is going to be more on strengthening and flexibility exercises for the knee joint. And I'd love to hear from you, so leave a comment and check out my website. I have lots of resources on it, on Ayurvedic medicine as well as physical therapy, and I hope you'll find it useful. Thanks again.